Welcome to EHRZip, the most efficient electronic health record platform ever built. To get started, type in www.ehrZip.com into your web browser, then click Login. Once you get to EHRZip Lookup, you can click Register. This is the registration page. To start the registration process, all we need is your name and email, although inputting all information is recommended. Next, you can create your username and password. After, it takes you to the Electronic Medical Records Provider Agreement. Once you read this over, if you agree to the terms, click the Agree button in the right-hand corner to complete the registration process. The page you see now, you should be able to click the link on the screen to log into your organization's EHR. Go ahead and enter your username and password, click the login, and you'll be welcome to your home page. Account Overview. Welcome to your EHR homepage. Click the Account button in the upper right-hand corner. Located on this page are your account settings. You have user settings, patient settings, organization profile, and lastly, personal profile. The user settings is where you're able to add any staff accounts and determine staff roles. Roles include medical provider, clinical staff, and administrator. The medical provider will have complete access to electronic health records and is able to save and sign progress notes and documents electronically. Clinical staff accesses medical history, updates, diagnosis updates, and patient documents. Lastly, administrators are able to add and delete users/patients in the system and edit the organization profile. To add staff accounts, you only need their name, email, and username, and then you can send an account invite. Have your staff check their email, click the link, and follow instructions to get started. Staff is now able to create a password to complete activation. Once your password is created, and you'll be brought to the user agreement page. Once you read this over, if you agree to the terms, click Agree in the bottom right-hand corner, and you are all set. Staff is now able to log into organization's EHR. Adding patients. Click Add New Patient in the left-hand corner. All you need is the patient first and last name, although inputting all information is recommended. Click Save and you have added a new patient. Select Patient and now you are in Patient Chart. Patient Chart tabs include Soap Note, where MD is able to compose chart note, while staff is able to input other information, which include allergies, medication, health maintenance, vaccinations, social history, and family history under the Medical History Update tab. Under Diagnosis Update tab, you will have access to our dynamic and customizable ICD-10 database. This is all done in one screen, which creates a seamless and efficient work environment. Lastly, the Patient Documents tab allows staff to upload patient documents and route to the providers for review. Locate the Patient Info tab in the upper left-hand corner. Here, you can enter patient demographics. Search patient name in the search bar, click and input patient information. Patient is also able to edit demographics via the patient portal. To invite the patient, click the account in the upper right-hand corner. Type patient's first and last name, email, and username, and send account invite. Now patient can check email, click the account activation link, and follow instructions on screen to activate. Patient will need to create a password. Follow the instructions on the screen to go ahead and complete the password setup. Read the user agreement page, Once you agree to those terms, the patient will now be added to the patient portal. Patient will be required to log in to access chart. Welcome to the patient portal homepage, where you can see chart notes from MD, as well as patient documents, medications, and reminders. Patient is able to edit patient demographics and are also able to utilize the messaging system to reach out to office staff and MD. Patients are able to send messages to the clinic by selecting patient message in the top right-hand corner in the patient chart. Select add new message and type any message for the clinic. By providing a simple communication platform between patients and the medical clinic, communication time can be cut down by more than 50%. Clinical staff are able to screen all messages and route relevant clinical messages to the providers. In the Patient Messaging tab, staff are able to filter the view of messages also by providers and locations. Patients will have the ability to schedule appointments online in the near future. Patient issues. Select patient issue in the upper right-hand corner. Type patient name in the search bar and select patient. Staff is able to input patient's concern, and all issues can be carried out by the clinical staff. You're able to streamline communication regarding lab data, medication refills, reporting, carrying out physician orders, and much more. You're able to route your concern to the provider, and the provider is able to respond directly to the issue. Once the provider responds to the issue, the staff is then able to go in and complete the order. The issue page may be customized. You are able to change by location, view, and as well by providers and status.